Now this image here may look like something straight out of a horror movie or out of the old TV show The Twilight Zone. What this image really is an iron lung used to assist breathing for a child with polio. Now, what is polio? Polio is a highly infectious disease that can cause paralysis and death. When most of us think of polio, we think of polio as a thing of the past, and we are lucky that we do. In countries like Afghanistan and Pakistan, polio continues to plague children just like it did in the US before there was a vaccine, and polio was eradicated for the most part. Polio used to circle through the United States and cause many young children to die or become paralyzed. It took many years for a vaccine to be developed and for it to triumph over the great tragedy that polio caused. The first polio outbreak in the U.S. occurred in Rutland, Vermont in 1894. There were 18 deaths and 132 cases of permanent paralysis. So, Charles Caverly, who was one of the first doctors to realize that polio would occur with or without paralysis, did not realize that polio was, in fact, a contagious disease. He states, "I find but a single instance in which more than one member of a family had the disease, and as it usually occurred in families of more than one child, and as no efforts were made at isolation, it is very certain that it was non-contagious." In 1905, the contagious nature of polio was identified by Ivar Wickman in Sweden. He determined that polio can be spread from person to person and that people can have polio even without a severe form of disease. It was Karl Landsteiner and Erwin Popper that discovered that polio was a virus. Although polio is not visible without the electron microscope, which was not available until the 1950s, they were able to determine that it was not a bacterium, but rather something smaller. The men used a filter for bacteria and spinal fluid taken from a person who had died of polio and injected the filter preparation into monkeys who then developed polio. They concluded that polio was not caused by bacteria, but by a smaller infectious particle. Simon Flexner, a doctor at the Rockefeller Institute for Medical Research in New York, discovered that the blood of the monkeys who survived polio contained what he deemed germicidal substances. Other researchers found similar substances in humans who survived polio. These germicidal substances were antibodies. This indicated that maybe a vaccine could be created to promote antibody production. In the human body, antibodies mark a foreign substance for destruction. So, if polio antibodies were to be produced, then the polio virus could be marked for destruction. However, the polio vaccine was not discovered before polio was able to wreak havoc. Polio killed 6,000 people in the U.S. in 1916 and left many more paralyzed. Polio typically surged during summer months, just like one summer in Brooklyn, New York. In the summer of 1916, more than 2,000 people died of polio in New York. Polio led to the closure of many fun summer activities for children like pools and amusement parks. Since polio surged during summer months, many children had to alter their lifestyle. Dr. Everett Koop, former U.S. Surgeon General, talks about his experience with polio summer months as a child.
In the days before polio vaccine was introduced, we knew pitifully little about polio. But the thing that I remember most is that your parents started to worry about polio about the middle of July. One of the things that people were afraid of, very afraid of, were swimming pools and whether or not they passed the virus of polio on. So that when we were on vacation, let's say in New England with my family, and we would come home to self-imposed quarantine. And it was not the least bit unusual for somebody in the community to run in the house and say, so-and-so is paralyzed already, or so-and-so got paralyzed yesterday and now we think his brother is paralyzed. And so we lived with the thought of paralysis hanging over us, usually until the first frost came and everybody drew a sigh of relief and said, now it's over. I'm not sure that that was true, but that's what they said.
Polio infected and changed the lives of many people in the United States, including Franklin Delano Roosevelt.
former New York State Senator, Assistant Secretary to the Navy, and eventually U.S. President. FDR was left paralyzed from the waist down at the age of 39. He contracted it during the summer when polio usually surged. Because the disease was so terrible, FDR started the National Foundation for Infantile Paralysis in 1938. It played a large role in the fight against polio. In order to garner support, the organization decided they needed a catchy phrase to reel in support. They settled on the March of Dimes, a campaign in which they asked anybody who was able to send in one or more dimes to the president to assist with his disease. The March of Dimes was especially effective since it had the support of the president and the administration behind it, causing mass sympathy from the American people. It was established so any person who wanted to could help, no matter how big or how small the donation. It was incredibly effective, and during the 1940s, it raised upwards of $50 million per year. Funds raised helped to fund polio care and helped fund massive amounts of research into a polio vaccine.
However, the capital brought in by the March of Dimes would be of little use without a reliable research program to fund. That opportunity came in 1948 when a young rising virologist named Jonas Salk had accepted a substantial grant from the March to develop the vaccine the world so desperately needed. Around the same time, another more established virologist by the name of Albert Sabin also began work on a vaccine in a project funded by the foundation. For almost a decade, both scientists were neck and neck in the race for a safe and effective polio vaccine until Salk finally won in 1955 with the injection-based immunization later known as the IPV.
The effects of Salk's vaccine were swift and only a hair shy of absolute. In the wake of the devastating epidemic of 1952 came a wave of mass immunizations across the United States, which was soon followed by the oral vaccine, or OPV, developed by Albert Sabin. While Salk had employed dead polio viruses in his treatment, Sabin used weakened viruses, which were thought to provide a more permanent immunity. As a result of this, within 10 years of the outbreak, American polio rates had dropped to a mere 900 annually. This marked the lowest frequency of the disease since 1900, and in the decades to come, rates would continue to fall, finally reaching zero at the turn of the century.
Much of the success can be attributed to Salk's determination to employ an inactivated vaccine, or one containing a dead virus. Although established medical gospel of the time dictated that only an attenuated, or live, vaccine could stimulate adequate antibody production for lifelong immunity, Jonas Salk was unwilling to deliberately pursue a riskier method if he could find an alternative. Decades later, both sides have been proven somewhat correct. Although inactivated vaccines do certainly work, they are often most effective when coupled with booster shots at several points later throughout the subject's life. In the 30s, Maurice Brody and William Park had already attempted to test an inactivated vaccine. However, many subjects contracted polio after receiving the injection. This made Salk's work even more dangerous, as the only previous major trial had proved catastrophic. Despite this, the product he eventually delivered was proved to be both visibly effective and, unlike the attenuated vaccine under development by his rivals, completely safe.
This period of history is hallmarked by the onset of polio throughout America. Between the rising fears and tensions of the American people in the wake of paralysis and death, and the inherent weakness and desperation of one of the most level-headed and revered presidents in American history being crippled by said malaise, the country faced extreme tragedy. Not only this, but this looming spirit of death carried on for several decades. When the polio vaccine was finally introduced into the American public, it represented a change for the better, a paradigm shift into the realm of immunology as we know it. The precedents set by the development of the vaccine allowed for future medicinal developments and the betterment of lands on Earth ravaged by similar diseases through these developments. Although widespread death and loss of morale in the American public can be seen as a tragedy, the impact of the disease in the fields of medicine and the moral implications of a president stricken with an incurable disease valiantly continuing forward in his job show a triumph of the American people through this time of darkness.